MCHRI. Thank you. We'll get started. Let's just give about 1 or 2 more minutes. A lot of people I can see are still signing on. We'll get started very soon. We'd love to have you on camera if you're willing. It just makes it a lot more fun, especially when we're doing community and you're a community work together. So thank you. We totally get if you're eating lunch. You're allowed to eat on camera. We do not mind. So please consider joining with your audio, excuse me, with your video, not your audio yet, but with your video, please. We have just 1 more minute for a few more people. I can tell we're already are still logging on.
I also see a lot of people who have advisory boards, so some of you could offer advice as well.
Yeah, it's wonderful. A lot of people we know. It's just fantastic to see you. Beautiful. I was saying before, welcome to our community engagement webinar hosted by MCHRI, the Office of Community Engaged Research. And please do feel free to put your camera on, even if you're eating. We don't mind. We know it's lunchtime, but it's just nice to see faces if possible. And we're just going to start in just a second or two. And as you know, as you probably saw, we are recording this. So wonderful to see you all. All right, Netta, let's go ahead and get started sharing screen if you don't mind, so that way we can get going and give as much opportunity as possible for everybody to hear from our amazing speakers and have some time for discussion. So I want to welcome everybody to the please, thank you to the MCHRI seminar on community engaged research. I'll working with community advisory boards and youth advisory boards. I'll introduce myself quickly and our other 2 speakers in just a minute. I'm Bonnie Halpern-Felsher. I am a professor in pediatrics, adolescent medicine. I do a lot of work, and actually some of my team members are here, including the person who runs our advisory board. So I'm super excited to be your moderator for this hour. Next slide, please. Little bit of housekeeping before. First of all, just a shout out and a thank you to the MCHRI Education Committee. You can see those names here, who are the people who bring a lot of the education from MCHRI to you, including today. Next slide. And just a wonderful symposium coming up on October 24th from the MCHRI. On information and disinformation in maternal and child health. Encourage you to save that date and join as well. And now our next slide. All right, so on to the main event. We're really excited to have 2 fabulous speakers talk about working with community advisory boards. We have Shazeen Suleiman, who's a clinical associate professor in pediatrics. She also co-directs the Community Engagement Office of Child Health Equity and a co-director of the Scholarly Concentration in Community Engagement and Advocacy in Pediatrics. And she is the PI, or principal investigator, of her own lab called the Compass Lab. And then Katie Kahn, who's a clinical assistant professor in urology and has her own lab as well. So they're going to take it away, and then I'll pop back in to talk a little bit about youth action boards and youth advisory boards as we go. Please do pop into the chat any questions that you might have, and then we'll make sure and moderate those towards the end. We'll have about 10 minutes for questions. So I'm going to hand it over to Katie and Shazeen, and thank you, everybody, and thank you, Katie and Shazeen, for speaking.
Thank you, Bonnie and Anisha and Dog May and the whole MCHRI team. I know Katie and I are really excited to be here and share with you our experience working with community advisory boards and research. And as we begin, as we talk about community engaged work, we recognize that today Katie and I are joining you from the traditional territory of the Ohlone people, the Muwekma Ohlone people, and many of you might be joining us from all over Turtle Island, which is most parts of North America. And we encourage you to take some time to understand whose land you're on and how the work that we do is intimately connected to supporting Indigenous communities, as well as the communities with whom prosperity was built on their backs and labor. So these are just our disclosures and some of the funding that we've both received. And today we're hoping that we'll just share with you a little bit of the spectrum of community engaged research, which many of you know, and some of the role and benefits that community advisory boards can have in this research, share with you our approaches that we've used in developing, training, and maintaining community advisory boards, and consider different aspects that you might need to think about as researchers when you're working with community members with a particular focus to those who may be living at the margins of society. And I'm going to turn it over to Katie to walk us through community engaged research.
Okay, so what is community engaged research? We're going to do a brief review for those of you who are new to this, but really it's what the name suggests, but really thinking about the way that you're engaging with your community. So it's a process that's going to incorporate input from your local community, and your community is really who the research is going to impact, and therefore you're going to involve them. And I think the key thing about this relationship is that, we can go back one more, is that you're going to be equal partners, right? So I think as we go through the rest of these slides, really keep that in mind, that you may be a researcher, you may be part of your community, but as you're involving your community, just think about that, equal partners. Okay, next slide. And this is just a helpful way to sort of conceptualize how involved your community can become. It's different for all different types of researchers. It's different for all different kinds of clinical problems and research questions that we're going to have. And on the left, you'll see community education, which is what we sort of traditionally think of, where research and findings are just communicated to the community to make sure that they receive information. And then you go to community focus, where you're really starting to think about who your work is impacting, community-based, where you're really in the community, trying to solve specific problems. And then lastly, you're going to have this community-based participatory research with the community. Again, equal partnership. Great. So what is a community advisory board, right? That's what most of you are here really to learn about today. So it's putting together a group of community members who are going to be impacted or affected by the topic in question. So I'll just give you a short example. We're going to get into these examples in the second half of the talk, but I'm a pediatric urologist. I see children who are referred to me for bladder health problems, whether that's daytime or nighttime wetting, pain, things like that. And so when I think about who these kids are really interacting with and impacting with, we thought about parents, we thought about schools, right? Teachers, school nurses. We thought about clinical settings like pediatricians, and we thought about community health workers, right? And then we went ahead and we asked those members who else might actually be impacting the health of these kids. So all of these different types of individuals can be engaged throughout the entire research process. And later on in the second half of the talk, we're going to be talking about some of these logistical things to consider when forming a advisory board. Okay, and then one last sort of thought when we think about community engaged research. Again, it's a spectrum. It's going to take lots of different forms. And as a community advisory board becomes more and more experienced, the potential of what they can contribute and how you can involve them can grow, right? So similar to the prior slide, you can do some outreach first to talk to your community. You may then consult individual members, or maybe your advisory board can bring you some information, right? You can ask them questions. You can start to involve them in designing things, and that's really getting to collaborating, but you can involve them in terms of your actual research. You can collaborate, and then you can actually have shared leadership, which I think is where you start to train and elevate these members, again, as equal partners in making these decisions for you or with you.
So as Katie said, it's important that we remember that there's not one community. And even when we think about ourselves, we don't belong to just one community. For example, I'm part of the Division of General Pediatrics. That could be my community. I also work at Gardner Pediatrics. That is my community. But I'm also Canadian, for those of you who know me. And so maybe some of the Canadian expats at Stanford are my community and my ethnocultural group. So there's not one or even one best type of community. And it can be easy for us sometimes as academics to generalize everything external to our institution as community. But it's just important to remember that it's anybody who's united by a common characteristic. So whether it's geographic location, culture, language, it might be a neighborhood, it might be a group of patients, and it might be the broader community. But like each of us, different communities also have different access to power and privilege. And that will influence how much people have been able to impact research or findings or healthcare to date.
Okay, so why form a CAB, right? What would be the ultimate goal? I think one of the things that we can think about in terms of an example is like modern clinical trials and some of the issues that come with designing these trials, recruiting participants into these trials. And when you think about as researchers, you have a clinical question. You might even have a solution like a medication or an intervention that you're hoping will really bring positive health outcomes. CABs really can increase success of all of the aspects of your research, right? So as you're thinking about, does my community even need this intervention, right? Before you even put time, money, effort into this, does my community actually need or want this? Would it be well received? What else might be better received? That's like a first step, right? And then thinking about, okay, how would I go about designing this so that my community can maximally participate in this, let's just say, clinical trial. Then with recruitment, right? Lots and lots of issues out there with recruiting into these trials, making sure we have a diverse population, making sure that the solutions we're coming up can positively impact all communities. CABs can help with recruitment. And then again, understanding what the results look like, disseminating findings so that this work has the maximum impact. I think, again, CABs are beneficial in all these senses.
So this was in my head of, so you think you can dance? So it's like, so you want to have a community advisory board? And so what are some things that you need to consider? And as we share our experiences, we just want to remind you all that this is not a one-size-fits-all approach, but general principles to consider. So it's important that when we engage with individuals, certainly as we are affiliated with academic institutions, that there is a history of mistrust between many communities of color and academic institutions. And that is not about individual responsibility, but recognizing that as we now come connected to an institution, it is on the onus that we have to kind of build back that trust. It means we need to enter partnerships with humility, with appreciation for what our community partners can offer. And it's very hard for people outside of the university, and certainly even for me as someone relatively new to Stanford, to even distinguish what part of Stanford is doing what, or what part of our institution is doing what. And all this means is that, again, being mindful of this before you're engaging with different partners in your work. Many of us have seen something similar to this, and I love this image from Sylvia Duckworth because it shows how power and privilege are on multiple different axes. And as we all look at this as individuals, there may be moments in time where we actually have more power and moments in time where we have less, different parts of the spectrum where you actually might be more towards the margins and more towards the center. And again, taking a moment to understand where you as a person intersect with your power and privilege, and how that influences how we have relationships or build relationships with others can be really informative at the very beginning of developing your community partnership. In a way, this is like the pre-work that we do as we're starting to think about a community advisory board. It's important that you also take time to build trust, because as part of an advisory board, you want to hear all voices. And I'm so sorry about the background noise. I'm in clinic right now, so I hope it's not too disturbing. It's important that as you build trust, that you can, one second. sorry, it's important that as we build trust that it's important that we hear all voices, including dissenting ones. So for example, in our advisory board, you want to hear from other people who may say, as Katie said, that's not a project that's important to us. Actually, this is not important to us, but this other aspect is important to us. And that's what adds to the strength of the project. But in order to do this, there are ways that you can set up your advisory board for success so that those opinions can be shared. And it's also why this personal work is so important so that we can reflect on our own biases and positions. So I'll turn it over. I don't remember if this is me, Katie, or if this is you, but I think this is me. Whereas we get started, before you even start, planning is important. And we can all follow Yoda here, where let's think about what it is that you need to plan. And I'm going to turn it over to Katie now to walk us through some pieces that we want to plan.
Perfect. So these are considerations that we're going to walk through step by step. Hopefully you all will have access to the slides. And so there's a lot of good information here. We'll kind of breeze through it and answer questions. But I think I formed one CAB. And what I learned in doing this with planning ahead was you'll see here things like budgeting, thinking about funding. So for all of you who are listening here, who are thinking about starting a CAB or growing the CAB and thinking about how am I going to actually do this, I think this list is a really good, we put together sort of like a cheat sheet for what you would ask for in your budget, what you would ask for in a grant, and what you really need to be prepared to manage over the course of the group. So we're going to talk about where to find CAB members, setting expectations for the group, creating a cohesive identity, scheduling multiple members, budgeting, running the actual meetings, training members, and then a discussion of each of the challenges and considerations that we've come across. And we're just going to be, Shazina and I are going to be giving you examples from our own experience. So again, these are samples for you to use. Please don't feel like this is the only way to do a CAB, and we'll go from there. Okay, so recruiting. So where to find CAB members. So like I was initially talking about, I started with a very clinical problem that I was seeing frequently. And so I started with patients and families initially. Unlike sort of clinical trials and things like that, you can put up a flyer and say, hey, we're recruiting for this CAB. You can do kind of traditional recruitment, but you can also use other types of sampling out there that can be really helpful in finding sort of the most enthusiastic, right? Or the most willing to participate, who have a lot to offer. So think about things like convenience sampling, right? So if you've done studies before and you had, let's say, I had parents who had participated in qualitative work with us, and we had some folks who were really saying, hey, I want to participate in future studies. That's convenience sampling, right? We sent an email to those folks. You can also think about things like snowball sampling. So that's asking other folks to help you find additional enthusiastic members. And I think enthusiastic is really the key term. So it may not be as straightforward as just posting a newsletter and thinking that like everybody with pediatric bladder problems is going to want to join your CAB. You can also think about community-based organizations. We partner with El Timpano, who's a Spanish-speaking media organization that helped us actually send out some information to families and then actually vet who might be the most enthusiastic. And then stakeholders and policymakers. And for me on this list, I work with Santa Clara County Office of Education, hopefully in future studies, to pair with schools. Right. So thinking about who might be somebody who can get you access to teachers, school nurses, policymakers, things like that.
And as an example, so I am working with my 6th community advisory board. All of my advisory boards have been very project specific. And I have actually been an advisory board member when I was a young person. I like to think I'm still young, but I was a younger person for the Canadian Commission for UNESCO, which is also what informs some of my work. And so like Katie said, I think about the phrase, nothing about us without us is for us, which is a phrase from disability justice advocates. And for me, that means who is on my advisory board, are the people directly impacted by the issue or the project that we're doing? And do they have the ability to shape and change the impacts through policy and programs? So some advisors are former and current patients of my, or current parents of my patients. Some were identified through community partners who I work closely with. And so in my case, I primarily care for migrant children and children with special healthcare needs, especially neurodevelopmental disabilities. So these are the agencies that I work closely with. And I also have a stakeholder advisory board that is currently being built in San Mateo, which is including representatives from the school district, legal aid, and the county, because these are key decision makers that are going to elevate findings from a youth advisory board of my community partner, that the community partner has their own. And so it's a way to kind of elevate those voices forward.
Okay. So next we'll talk about setting expectations, and there's certainly a lot of different ways to do this. When we say setting expectations, we mean like telling people what you as the research team are expected to do. So what your role is actually going to be. And then also telling the CAB members, hey, this is what we would also expect from you. And it can be, this is what we expect during the actual meetings, but it also can cover things like, hey, if you can't make it, right? If you're having an issue, if you feel uncomfortable, here's what we're going to be able to do. Here's what you should also be able to do. So for our CAB, we did a letter of agreement. So it was a really simple form that just said, and you can see the sample here, here's what our research team will definitely be doing. Here's what you will be doing. And it had a lot of different, here are contact numbers. Here's how to reach us, email. You let us know how to reach you best. You can tell us how you want to be communicated with, things like that.
And similarly for my work, like how I've been setting expectations depends on who is actually part of the advisory board. So for example, I work with families who were migrants and so may have lower literacy, may not have full English proficiency. So we would actually have this expectation setting in a conversation with pictures and using questions, for example, as you can see here, as headings for what the expectations are, and using interpreters if needed to help ensure that we are all on the same page.
And then creating and supporting a CAB identity, right? You want to make sure that everybody who's present understands why they're there, right? And has buy-in as to what we're doing here, what our goals are, and the ultimate sort of goalpost that everyone's moving towards. So on the left, you'll see a little snippet of our flyer. You'll see some of the education content. It was really for us about how do we think about delivering really great, high quality bladder health education to families so they understand what they're supposed to do to either treat or prevent bladder health problems. That was like the whole goal. We saw this gap. We were trying to fill this gap, and we were trying to make this a really fun, positive experience. So we came up with like a vision statement and a mission statement. The group wanted to do this. And our very first meeting, we had a large conversation. We had some breakout discussions as well about what everybody was really here to do. We put together this mission statement and then we shared it back with them the next meeting. And they were very involved. They had edits. They wanted certain things changed about the language. They really cared about making sure we could prevent things, so it's been an iterative process. It wasn't us telling the group, here's what we're going to be doing. It was also asking.
And similarly, in my work, and I'm sharing what I have here are samples from our group's principles and group visions from a parent advisory board, which is co-designing a navigation program for migrant children with special healthcare needs through a randomized controlled trial. And you can see that we actually took time in one of our first meetings to co-create what our principles were, which came from the parents to say we respect ourselves and each other, we value each individual, we work with honesty and in collaboration with one another, we value confidentiality, trust, and working in a culturally safe manner. And this has helped create a really cohesive identity and have all the CAB members working towards this group vision where they say, we, the parents, envision acting as agents of change for better and equitable healthcare services. So all the parents on this advisory board, themselves were new to the country and had a child with complex medical needs. And they've actually created a logo for themselves. They call themselves the Parent Change Makers. They have a WhatsApp group. And I think that's another incredible way that you can support your CAB identity, especially when you're working with individuals who may be living more at the margins.
Okay, so scheduling and logistics, right? So you're going to bring a large group of people together. Hopefully, you know, for our group, we meet quarterly. So you've got to find the right date, the location, everything like that, right? You've got to bring everybody together and figure out how to do this. So you're going to really think carefully about who's now involved, right? Who's committed to joining this and what are their needs? And so things like interpretation are important. Childcare are important. For example, we are really trying to work with both English and Spanish speaking families. And so actually on this talk, I see Pranaya here. I think Ashley's here and Chenshi's here, right? This is like my team that's able to think about these logistics, make sure they're heard. And Pranaya in particular is bilingual. And so we have somebody in those meetings who can assist with any language needs. The what is also things like accessibility, right? In order to participate well, so for example, ours are on Zoom, we had to make sure that everybody felt really comfortable with Zoom. We had breakout sessions and things like that, making sure everybody understood what buttons to press, things like that, but also other accessibility needs. If you're meeting in person, you can think about food, right? Especially if you're meeting around dinner time or people are traveling, they're going to be a little hungry, and food always helps. And then other supplies. And in our case, that's things like even printing or translation. Sometimes we do have to think about that.
Mm-hmm. And you know, even things like timing. So again, thinking about who you're working with, I work with parents who have kids who have really complex needs. So sometimes meeting is better during the day when the kids are at school, and sometimes it's better in the evening. If you have advisory boards where there's time zone considerations, try not to have one at 5 o'clock in the morning for someone. But this often does mean working outside of what we would consider our traditional hours, because it's about what's best for who you're working with. And then I think also thinking about where you have your meetings, it depends on making sure the space is accessible and safe for everyone. Some of my most some of the community advisory boards I've worked with we've always met in the community center where the family is most comfortable. And for example, it'll be a space where one side of the room is the kids are there. We've got pizza for the kids. Half my team came and did all the childcare. And the other half of the team is with the parents and dinner and sticky notes. And we're having our meeting at the same time. And that's what the families wanted. Sometimes online is better, but again, it may not be safe for everyone. And remembering that your group doesn't always have to meet all at once, just like any advisory board. There have been times where one parent can't meet, and we met with them in the lobby of their apartment building because they really had some ideas to contribute, but because of their child's medical condition, they couldn't make it to one of the appointment times. So being flexible is a really big part of working with our advisors. So when it comes to budgeting, as you can imagine, all the things we talked about, they don't just materialize out of thin air. And so it's really important that when you want to do this work, you budget for it just like you would with any other line item in your research. So thinking about compensation for members, making sure that you are compensating them for their time, and even deciding what that compensation is and looks like can be discussed with your team members. Again, putting in budget for food, childcare, transportation, space if renting, supplies, and interpretation. I'll just go to the next slide if that's cool, Katie. Great.
And then actually running the meeting, right? So you've thought about all the planning, all the logistics, you've brought everybody into one, space. How are you going to actually maximize this, let's say, hour and a half, 2 hours, or whatever time you've set with your group? I put on the right side here an agenda that's sort of typical for our group. Our particular group really liked to know exactly what they were doing, just in case they were interrupted or something like that. They could follow along with where the group really was when they came back, and we put in breaks. So you'll see here, we do like a 10-minute, 15-minute block. We tell people, hey, this is going to be a group review here, and then we're going to do breakout sessions so you can kind of know what to expect. The other thing that I really like to do is to always do a recap, right? To think about that as part of your meeting. You want to show these members how their time and their effort and their feedback is impacting what you're actually doing, right? How you made decisions differently. So we always spend a little bit of time in the beginning saying, okay, this is what we heard from everybody, and this is what we actually did.
And similarly for us, I think planning for the CAB is so important because even in my experience, if people are meeting over Zoom and we can't provide food in person, we still try and send everyone, an Uber Eats gift card or something to say, thank you for coming up and showing up with us in this space. We find having a check-in, just a check-in where everyone's emotionally at, especially that I work with families who face so many barriers to their lives. Part of this is also about empowerment and building community together and building space for that check-in in your agenda. As a facilitator, if you're running your CAB meeting, you may be the facilitator, or a CAB member may be the facilitator, but it's really important to equip whoever is running the meeting with those skills so that they can facilitate and use that time effectively. And just like Katie, we also will tend to do a recap, and you can see a different visualized way, for example, of a recap we did, which was in co-designing the navigation program. These were the competencies that the members had defined.
Okay, wonderful. So training, and I think we see all of these questions in the chat. So I just wanted to point out, we'll definitely make sure to answer some of these at the end.
Yeah. I'm following along. Don't worry.
Okay,
Thank you.
great. So CAB training, because I saw one pop up about co-leading and things like that. And so I think training is something that is really great to consider for your CAB members, because as Shazina had said, a lot of these members are going to be new to research. And so you want folks to feel like there's some level setting in terms of what's okay and how far their influence will actually impact your project. So for us, it was really interesting for this CAB. I'll share with you all that we had pediatricians who had previously been on research studies and CABs and things like that, who felt very vocal and very okay speaking on this topic. We had parents who had previously worked with us who felt really comfortable in that qualitative, like a focus group or, interview setting. But when you put everybody together, I will say in the first few meetings, you had, school teachers and pediatricians being very, very vocal in the beginning. And we made this, concerted effort in our first meeting to give every single person time to speak and set that expectation up front. And then as we did more and more training, so we used a Connecting Communities to Research, which is a Boston University training. We actually did the training in the CAB meetings together. We would use some of the CAB meeting time. You could see that the parents and even some of the other members, the community health workers who weren't as familiar with the structure, became more and more comfortable. Some of it by familiarity, but also some of it, I think, through the training itself. So there's a lot of different trainings out there. There's the certification course from U of Chicago. I liked the one from Boston University because it was very much focused on new members and understanding just even the world of research or what research is. And there's a lot of different resources, and we have some slides at the end for that.
And similarly for me, we also, my CABs are parents primarily who are going to be the end users of these programs. So many of them are refugees, and some are undocumented, some are asylum seekers. And so recognizing that not everyone has the same exposure to education, and some were highly trained individuals in their home countries, but face a myriad of different barriers. And so we adapted tools from the PCHRI database to actually, like Katie said, actually teach, what is research? What is a randomized control trial? What is a delayed response? Why are some people getting the intervention right away and some people aren't? Let's talk about questionnaires. Let's talk about what we can or can't do. And so again, we've seen how different members of the CAB are able to participate more fully as you kind of start with the lowest common denominator and educate upwards from there. And mistakes happen. You know, it is hard. As Katie said, a lot of people are new to research. So some people may not know research processes. Some people may not understand how informed consent works, may not understand how you can do data collection or data privacy. It can be really hard when you have a mixed cab where you have people coming in thinking about that wheel of privilege and power, that every one of us occupies different spaces. Some people may come into that space with a lot less power than others, and navigating those power differentials in a cab meeting can be tricky. It can be hard sometimes to hear about priorities that are so different from either the needs or capacity that you have to address those priorities. And that's where good facilitation, listening, and honesty about being honest about what you can do and what you can't do are so important. And timelines can be so different. The way we work in an academic institution or even a clinical institution is very different from people who work in different industries. It's different from families and parents. And so being kind to yourself and the timelines, in my experience, this always takes much longer than you expect it will, and that is okay. I don't know if you wanted to add anything, Katie. No, cool. So as we talked about, there are some special considerations that you want to keep in mind when you have a cab, and we're not going to talk at length about these, but just as I said, consider the discrepancy of power. And like Katie mentioned, having strategies to equalize some of that power when you have cab members who might be coming into that space. Really try to make sure that you're engaging people with limited English proficiency as much as possible. So if it's a bilingual team, having bilingual folks. I have cabs where we have 6 different languages, and there are ways in which we can engage those members fully by having one-on-one meetings, by having translation of documents, by having multilingual team members, and by having interpretation available. Consider immigration status, particularly depending on how you're compensating individuals. People may be quite apprehensive about participating if they feel really long forms that they need to fill out, but that may also mean if you are working with people who are living at the margins, their voices and their experiences matter greatly. And so again, just being mindful for how these pieces can impact inclusion. And similarly, when you're working with neurodiverse and disabled folks, be mindful of how people can communicate. For example, are you working with the deaf community, and do you have ASL and deaf interpretation available? Are you trying to make sure your font is disability friendly? Are you also having things audible as well as written? Are you using large fonts? There's just ways in which you can always think about making your work more inclusive. And when we work with Indigenous communities, it is important that we always respect their sovereignty and data collection. And there are guidelines I'd be happy to share about how we can do that effectively. And I'm going to turn it over actually to our moderator to talk about working with another population, which is youth.
Hi, everyone. I know time's getting tight, so I'll make this pretty quick, but I want to talk about exactly what Shazine said, another aspect of tabs, which are YABs. We love calling our Reach Lab YABs. And shout out to Marcia Zaria, who's actually on this call because she actually runs our youth action. We call it a youth action board, but youth advisory board within. So I'm just going to quickly, I'll put some stuff into the chats, but this is one link that will actually show you a little bit about our YAB that we have. So next slide, please. So just this picture, and you can flip through the next, just to show you some faces of the amazing youth we have. So we have a right now 38-person youth action board, and they are young people, 14 to 22-year-olds throughout the country, mostly, well, actually one across the in another country. They are mostly California, but again, all around. And we've got high school all the way through college. Once they're 22, they then are no longer part of our YAB. And they help us in everything that we do, from research to advocacy to advising us, to education, to developing curriculums. They're the ones who say, oh, that's so yesterday, that's not important to us anymore, whatever it might be. Nothing that we do in our lab is action without first setting it through the YAB at some level. So next slide, please. So just some stuff, and Marcia, thank you. I stole this from you, but revised it. Just some of the things that they do, and we have 2, 3, 4 slides of just the last year, but just to give you an idea of what YABs can do. So like I said, they do help with research, advocacy, and education in every aspect. Our YAB have an Instagram. So my research is on adolescent, young adult drug prevention and safer, if they are going to use, harm reduction, safer drug use, prevention, intervention, cessation, and so on. So having a youth voice, that is our Reach Lab YAB Instagram, really is helpful, and they run that. They give presentations to schools. They do trainings of educators and youth outreach workers. They participate in conferences both in the Bay Area and across the country. They participate in national conferences like National Take Down Tobacco Day with yabbers, we call them yabbers, across the country. We did a forum theater. We're doing some work with some policymakers around fentanyl overdose prevention. Like I said, everything. They participate in research and so on. So next slide, please. But when you do this, you do need to know about some Stanford rules. I'm going to go through some of them, and then I'll pop my email into the chat. Please reach out if you have questions, because there are a lot of nuances to discuss. So first of all, you can't just simply create a YAB. They have to go through Stanford, and typically our department and our HR and Margaret Murphy in the Department of Pediatrics. I don't know in terms of the Department of Medicine or the department, so find out. But there should be somebody who is overseeing helping you get these set up. So in Department of Pediatrics, for example, we have to register. And it takes about 4 weeks to get any individual young person on board, whether they're part of an internship program. Our YAB is now an internship program, but even if they're just being a YAB that you're working with, and the rules change all the time. So keep up with them, or you don't have to keep up with them. Find out who your point person is. And again, I'm happy to help. There's always a 2-to-1 or 1-to-2 ratio at all times. So if you're working with anybody who's under the age of 18, you always have to have 2 adults and 1 teen, or 2 teens and 1 adult at all times. And that's whether it's phone, email, Zoom, or in person. So it means that if you want to work with a YAB, that's great, but you've got to make sure you've got an adult. And actually in our lab, not by rule, but sort of by convention, we often try to have multiple adults in the room at the same time. There are restrictions on hours, how many hours per week, and what times of the day that they can work. They have to be at least 16 years of age if you're actually going to have them work as research assistants. If they're yabbers, more like a youth board like we have, you can go to 14. And then there are differences if it's virtual or hybrid or in person. Even in our YAB, we have some who are doing all different iterations and computations of this. And then we have to have individualized plans and then general plans. And then when COVID sparks up again, there are different plans. So I'm not telling you everything because it changes on a regular basis, but I want you to be aware so you don't just simply grab a bunch of youth and start working with them, that there are rules. Next slide, please. So everyone, and I'll put these in the chat, everybody who's working with their YAB have to go through different training. So first of all, you have to be fingerprinted through LiveScan. And I'll show you that in a minute. You have to complete minors training, which is quick online, about 25-30 minutes of training. And then you have to be entered into the EPOM system. So let me quickly show you, and I'll put the links in the chat so you're more aware. Next slide, please. So this is your minors working with young people. You first of all, your LiveScan is here, this is working with minors. So you have to go on, complete this course, and then also do the mandated reporter. I know that you're all mandated reporters, but you have to actually complete it through this system in order to then be on the LiveScan. And then next slide, please. Here's your LiveScan information. I'll put that in the chat. Everybody has to have that fingerprinting. Once you have it done, you've done it because your fingerprints are in the system. But you have to have this and have the results back and registered prior to working with your YAB. And then the final one that I have for you, this is the EPOM system. And everybody has to be into the, hopefully that came through, into the EPOM system ahead of time as well. And you can't just get in the system. You actually have to have it looked at and approved before you can start working with your youth. So the point is, and again, I'm going quickly in the interest of time, but the point is when you're working with young people, I encourage YABs. It's the best thing we do. They're amazing. But you cannot just pick up and say, I'm going to start working with your own YAB or another YAB without going through these issues. And the final slide, just to give you the resource that we turn to, this is your protection of minors. That's really important. But I would say even if they're 18 or over and you're still calling them a YAB, you still have to make sure that you go through a lot of the rules and get them registered. You can't just grab them off the street and start working with them tomorrow. And I'll take questions when we have time. All right, back to the others.
So we're almost done, but I think what we wanted to share with folks is just how much we've learned through working with community advisory boards and how important it is to be accountable, to be humble, flexible, transparent, co-ownership, being honest about what we can and can't do, making sure people are compensated for their time, and being mindful of language.
And then just a few slides that we'll include. This is for funding opportunities for those of you who are looking for support for a CAB. I think both Shazine and I have received the MCHRI Community Engaged Research to Promote Health Equity grant to start this. That was the one that funded my CAB, but also the Office of Community Engagement, Spectrum, Impact Labs, and HEAL all have pilot grants. And then externally, we put some examples of foundations and institutes that have funding. And then we've also included some toolkits for those of you who are interested, and then some additional training resources. Great. Thank you, everybody. We really hope that you are both inspired to engage in CABs in your work and now know how to get it done. Thank you, and we'll take questions.
Thank you, Katie. Thank you, Shazine. That was fantastic. We've got plenty of time for questions. There are a couple that came up in the chat that you probably already saw, but one of them, unfortunately, I think the person, Yain, had to leave early, but wanting to understand about if there are many CABs to inform more than one research group. I think maybe they mean like having an established lab who could be helpful across, established CAB, excuse me, helpful across, and particularly looking at community-based harm reduction or rehabilitation groups. I don't know, I think of harm reduction in the drug prevention world. I'm not sure if that's what this means specifically, trying to figure out how to connect the fellows in a way that respects the harm reduction rehab communities that I have worked with. Any thoughts on that one?
One thought that comes to mind is also how advisory boards are not limited to us as academics, but our community partners and agencies and partner, like, for example, I know one of my colleagues, Dr. Tina Bicey and Dr. Annie Behrens, are working with a community agency called ALAS to set up a community advisory board at ALAS. And ALAS then can respond to lots of requests for different projects, but they have the best interests of the community, which is a migrant farm worker community, in mind. And so I would, part of me hearing this is that, are there agencies that really work closely with harm reduction and rehabilitation that may actually be able to, we may be able to support building their capacity to kind of be sounding boards for these types of projects rather than having a project-specific CAB? And I'm not sure if Katie or Bonnie, you have any thoughts.
I'm going to put one link into the chat. When we started, we went to the Office of Community Engagement through the School of Medicine, and there is a CAB there that's meant to help Stanford researchers. Like, they want to hear about your projects, and then they're going to give you a little bit of guidance and input. So we said, hey, this is what we're really interested in doing. Who do we need to, like, here's our list of who we're interested in including. Here's our community partner that we're thinking about working with. Do you have any other thoughts, suggestions? We asked them about scheduling, logistics, things like that. So I'll put that in the chat.
And I would just argue, we also have CABs in our lab. We have a PAB, a CAB, and a YAB, parent, a community, and youth. And I would just say, having a general or generic YAB or CAB or PAB is fine, but for certain things like you're saying Yaun, if I'm pronouncing your name correctly, I apologize if I'm not, around substance use, I would make sure that it's people who have gone through substance use rehab and ask them, because especially for these more sensitive topics, having a general or generic, and I know that's not what you literally meant, but a YEB or a CAB from somewhere else, it's probably not going to have the same sensitivity, the power differential that you, Shazine, spoke so beautifully about, the privilege. It's going to be different. And so I would really argue to make sure, and I think the best CABs or any advisory group comes from the group in which you're going to be doing the research with, or generalizing the results too, would be what I would say. And you don't really need a lot of CAB members. You can have a 5-person CAB member and you do great. You can just grab a couple of people if they're representative of your population. So I would just suggest that. There was somebody else who said, let me get to the ARB one, but there was, sorry, where was it?
There was a question about leading and co-leading the CAB with a community member.
Yes.
I can definitely speak to that because the advisory boards that I have are primarily made of parents, and we rotate, who's leading the group each time, and there's capacity building and skill building around it. So I often think of myself as a researcher as much like a contractor. If you want a house built, you go to a contractor and say, here's the house I want, and the contractor builds it. So similarly for the community, for the parents, I'm the contractor and they come to me and say, this is what we want. And I say, great, let's build it together. And so part of that building is maybe putting the slides together, maybe doing some coaching, letting them know you're there at the back to kind of have their back in case they have questions. But again, I find that the building an identity and a culture of trust and relationships among the CAB members really helps with this. So I'm not sure if Bonnie or Katie have something to add.
Yeah, I mean, I often say, and we just got a wonderful community grant, and the CAB's actually going to be chaired by a CAB member, not by us. We'll be part of the team advising. So I completely agree. Let's talk about the IRB question, because I think this is huge, and I see Anisha laughing. We can all talk offline about this one a little bit more, but IRB and contracts and all that work when you're dealing with not just CABs, but any community work is really, really difficult. Our CABs and YABs are not research participants, so they should not have to go through IRB approval. The difference is if you are asking them to participate in actually data collection, then they're not human subjects, they are your staff, and they have to go through city training and all that. So it depends on how you do it, but they should not, and typically your CABs are not the one to fill out your survey. They should be advising the survey. But Shazine and Katie, please chime in.
Katie,
I
would you
agree,
like-
Bonnie.
yeah.
And for us, for the first year, we were funded by MCHRI, and we had certain deliverables to assess our CAB members. And so for that reason, we actually did submit an IRB. And so things like the letter of agreement, were part of that IRB. And that's so we could collect like one survey at the end of the year to say, hey, what did you learn? Did this meet your expectations? So we had to do it that way, but otherwise, agreed.
And I've worked in a couple of different institutions, and I think I've seen in my illustriously long career, as I'm joking, but I've seen even in a short period of time how community engaged work is becoming like IRBs, and in Canada, REBs are becoming more aware of community engaged research. And just like you might have academic collaborators who you're meeting with or advising, that people are now recognizing that that's what your advisory board is. It's just someone that you go to and bounce ideas off of. Absolutely, if you're evaluating your CAB, then that would need to go through IRB. But if they're not participating in data collection, like Bonnie said, then they're not research participants, in my understanding. They're community kids. Thank you, Anisha,
Yeah,
for articulating it
exactly.
much better.
Now, and even I would even argue, depending, even if you're evaluating your CAB, depending on how you do it, that sometimes could be even considered program evaluation, and you may even not need human subjects there. Like for our YAB, it's an internship program, so it's considered more program evaluation. So there are nuances. It just depends on how you go about doing it. But they should not, in general, be research participants or advisors.
Can I ask a question about this is Kim Pike Grimm, about the structure of a CAB. So I got the impression, and correct me if I'm wrong, if you could have English and non-English speaking advisors, or I'm trying to choose my words carefully. I'm going to say participants for the sake of selecting a word, on the CAB, part of the CAB, and they can be both English and non-English speaking, and you have interpreters sometimes who are there to help facilitate the discussion. The reason I ask, and that's one question. The second question I have is related to what is sort of the average size. And it sounds like you could have one as small as 5, but is there a sweet spot in terms of, I don't know if it depends on the question you're asking, but is there sort of a one that's too big to manage? But again, going back to the first part of the question, or would you advise having separate, if they're an English speaking CAB or a non-English speaking CAB, or I'm not sure about that approach in terms of language.
I'm happy to start with that one because I think I probably have the most language diverse CAB members. And hi, Kim, it's nice to see you.
Hey, nice to see you.
So, just like any advisory board, people can, if you have a board meeting, sometimes the board meeting everyone can come in person. Sometimes someone can't come and you meet with them on their own to get their feedback. So sometimes when we have multiple languages, I will at least translate all the written material into all of those languages. So all the slides will be in those multiple languages. If you have a bilingual, so one other language in addition to English, it can be helpful to have a bilingual person be able to speak in back and forth. And when I have tri or quadrilingual, I think the most I've had on one is like 6 languages. Sometimes we will actually have one-on-one meetings with each of those members to still get their input, and each time share what we heard from the other ones and say, okay, this came up in the last meeting at the last time we heard this, anything you wanted to add? And so it's still kind of building together. In terms of I hope that answers your question, but I think it's still so helpful and so important, because so often if you do have limited English proficiency, you're just left out, and those voices are so critical. So until we have a super, multilingual team, it's going to be so hard to do that. In terms of number, I can share with you my experience. The smallest one I've had is 4 people, and usually the largest I've had is 11, and that feels very manageable to me. I try to do between 7 to 9. I'd love to hear from Bonnie and Katie what their thoughts are.
Katie, go ahead.
Sure. I mean, mine is 6 to 8 members, and then depending on attendance, I think 8 is very manageable. And then we do individual Zooms for those who can't attend. And then Pranaya, who's on this call, is bilingual. So we have bilingual community health workers. We do have some translation of documents, but we mostly are available. Let's say for that last survey that we did, we translated the survey, but we were there in case there were any questions that came up. I don't understand this question. I'm not sure what this question stem is exactly, asking. Yeah, so that's how we do it.
Thank you.
And I completely agree. I think it also just depends on, again, it's sort of like measuring self-efficacy. You want it to be as specific to what it is that you're trying to ask. So I think, Kim, it's just a matter of what are you trying to get out of your CAB and YAB, and how are you using them, which may be really important. We are at 12:59 and counting. I just want to thank you all for being here. There are some answers to the chats that are coming for the specifics to MCHRI and the SURF grant. So please take a look in the chat for those answers. Want to thank our amazing speakers, Shazeen and Katie. Thank you so much for being here. Everybody, thank you for your great questions, your attention, for the great work that you're doing. Really appreciate that. And I believe, right, Doug May and Anisha, the recording will be sent out.
Yes, and it will be posted on our website, and that it will be sent to all the attendees. Are you here, Nera? I want to
Yes, I'm
confirm.
here. We'll be sending everything to our attendees.
Okay, great. Thank you, Nera, for the confirming.
Beautiful. Well, thank you all again. I hope you have a fantastic rest of your day and week. Take care.
Bye, everyone.
Everyone.